You are not. You are visible now.
Yes. As you are aware, lumpy skin disease epidemic last year was a new phenomenon in India, and what started in Gujarat as a sporadic outbreak, then it spread like wildfire to 22 states in India. And it came into UP in the month of August from Rajasthan and Haryana. So it's spread by a virus, and flies and mosquitoes are the vectors. So when it came to UP in August, if we recall, roughly around that time, there were large-scale cattle deaths in Rajasthan, which were covered by media, and there was a lot of apprehension in Delhi that what's going to happen as this epidemic has entered UP, which is the largest state with more than 5.20 crore of cattle and buffaloes. It affects buffaloes as well, they're hardier, so basically the challenge is to save the lives of cattle. The mortality rate internationally recorded average is around 5%. In India, the average mortality last year was 5.2%. So what is the uniqueness of nomination? Well, this was a huge challenge to us. It came unexpected. We never had this kind of an epidemic in cattle on such a large scale in India in recent times. So obviously, there were not that kind of preparedness in all the states, as is the case with the other epidemics in human beings. And we embarked on a major exercise of multiple innovations in mission mode. And Government of India did give us a biosecurity protocol, but then the micro level implementation issues were missing because even they had not tried this ever. So the positive outcome of this epidemic last year was that for the first time in the country, there was a recognition of the gravity of cattle health risk management. To put it in a figure, livestock contributes 7% of the total gross value added in the state of UP. Largely that comes from the cattle sector. So this is around $17 billion. We came up with the highest number of vaccinations in the country. We undertook a drive. There was mass mobilization of manpower in a very short time. And if we calculate on a very conservative scale, there was avoidance of rupees 685 crores of economic losses to farmers. More than 1 crore farmers were involved in this. And as we are aware, 25 to 35% of the income of small and marginal farmers comes from livestock. So this exercise, we believe, epitomizes the essence of Gau Seva. If you look at the landscape of lumpy skin disease in Uttar Pradesh, this is what was the final picture. It started from the northwestern side, Saharanpur, Muzaffarnagar, and Aligarh. Those are the red districts. Then you have orange, yellow, and green. So if you look at this blue dotted line running from Nepal to Madhya Pradesh, I would like to invite your kind attention to this blue dotted line. This was the macro level belt vaccination, which we undertook for the first time in the country. And ably guided by Commissioner Animal Husbandry, Government of India, and Duvasu Animal Husbandry University of Mathura. So over 7 days' time, we created an immune belt 10 kilometers wide and 320 kilometers long to serve as a breaker in controlling the diseases and virus spread from western to central and eastern. So if you look at the alarming initial trends of lumpy skin disease, the blue line and the green line, 21st August to 28th of August, and we had this daily data flowing in, and the gap is widening, and there was some kind of a panic even in Delhi that what's happening. From 25 deaths on 21st of August, it went fourfold high to 97 on 28th of August. So that was the kind of escalation which we were seeing in the initial stages. And the challenges were, one, lack of established protocols for lumpy skin disease management. So we had a broad guideline, that's all. and lack of awareness among farmers. Since lumpy skin disease has been happening sporadically, but farmers were not aware that it could have such a high level of seriousness. So behavioral change among farmers was a major challenge. Imposing boundary conditions and banning fairs, because we had several fairs going on and absolute restrictions had to be put up. Vaccination of 1.58 crore of cattle. Now, this was a humongous task, which we achieved in 2 months' time. Emergency procurement of vaccine and drugs, mass mobilization of teams, and lack of interdepartmental coordination and ownership. Now, this last point is very important because departments tend to work in silos. And animal husbandry is not a very glamorous department. So district magistrates also tend to hand it over to the chief veterinary officer and his team. And there is no ownership, which I believe was a great learning exercise in this entire event. Quick and professional response, epidemiological forecasting. So this we undertook for the first time, and I'm told we were the first state in the country to do it. So we took help from Duasu University, Mathura, and based upon wind velocity and the velocity of vector, how far can a fly in 1 day? So it's 1.5 to 3 kilometers depending upon direction, cattle density, and vector nature. So this forecasting on a weekly basis, we undertook and planned our resources accordingly because we were in dearth of vaccines, dearth of manpower, dearth of funds. So we had to work on in a very focused and staggered way. Constitution of Team 9 at the highest level, the Chief Minister took it on the pattern of COVID-9 pandemic control, and we created a Team 9 which met daily at state level and a district level task force headed by DM. And then there were around 10 departmental officers working under him. So district and block level IC, this was the third very important component, was information, education, communication. Because how do you make the farmers feel that this disease is important and what are the do's and don'ts? So we printed pamphlets in simple language. We distributed those pamphlets right up to panchayat level at each Goshala. There was a 3-tier capacity building exercise in a hybrid model of Zoom coupled with physical training at the field level. So this capacity building, this communication was a very, very major exercise. Banning of fairs was not an easy thing, and we had to ensure participation of the police. When we went for banning of the fairs, the fair organizer said we have put in X amount of money. So then it was again a behavioral change exercise, and on a very large scale mobilization of 2,000 teams of 6,000 plus workers, each team consisting of 1 livestock extension officer and 2 paravets. And then we had to have mobile veterinary units for these teams, and we had to monitor them on a very intensive scale. So we went for 24/7 command control center. We had Google Sheets, and we used to take daily information. Emergency procurement of goat pox vaccine. Now, goat pox, it cross immunes against cattle pox. So only 2 companies in country produce it. So we went for emergency procurement in a very transparent fashion, and the rates in UP were the lowest in the country, 5 rupees plus GST per dose. And Government of India took our rate as the standard rate for procurement of goat pox vaccine from private companies. Quick rollout of protocols and innovative models. What are these models? You can see mission approach through convergence. So convergence of various departments, be it police, be it panchayats, be it urban development, and our municipalities, because municipalities also have cattle. Then you have animal husbandry department, health department. So all these departments converged. There was a weekly video conferencing headed by Chief Secretary himself, 3-tier capacity building and sensitization. This was again a massive exercise, which we undertook. Sensitization of people, sensitization of paravets, Maitreyi. So Maitreyi workers are paid on a per case basis. So we took it up with the Government of India. LSD didn't have any per case basis compensation. 5 rupees was decided. And we pushed this in Government of India, and finally, that's it. Improvised vaccination strategy was a major innovation in UP. Since it is a huge state, so we focused it in a staggered fashion initially on the western side. You have what we call a belt vaccination, but we went for two large belts, macro level belts. One was 320 kilometers, one was 155 kilometers, done for the first time in India. It required a lot of planning and micro level exercise. Then we also went for circular vaccination around major cities because most of the dairy sector animals are just outside your municipal areas. So the dairies have been shifted outside the cities. So we went for a saturation vaccination there in hotspots like Mathura, where Mataji Goshala has 40,000 cows. We can imagine what happens if the virus reaches Mataji Goshala and 40,000 cows are affected. So Mathura was one of the first districts to get affected. So we did a carpet bombing of Mataji Goshala. We saturated the Go Ashray Sthals, and establishment of 89 dedicated isolation centers again was a very innovative step, where we dedicated certain isolation centers headed by a nodal officer and a veterinary officer, and we transferred infected animals from Goshalas and from first infection in a district to these dedicated centers so that the disease doesn't spread. Then protocols like dead body management and waste management protocols. There was a lot of hue and cry in Rajasthan and Punjab over this. Administration of 2 million ivermectin bolai. Ivermectin is anti-parasitic, but it provides us some kind of cross immunity. It was tried in COVID, we tried in LSD as well. Trend of LSD in post-deployment period, as you can see on 25th of September.
Sorry to interrupt, sir. Keeping the time limit in mind,
1.58 crore vaccinations.
Request you to kindly conclude in next 1 minute. Sir.
Blue and red lines are converging. Yes, of course, please. So on 30th of October, we had virtually covered the entire susceptible cattle population of UP. So we started on 25th of August and we concluded on 30th of October. So that was the kind of drive which was undertaken, and this drive included inventorization, transport, storage. Trend of active cases, you can see 9,000 to 20,000. It peaked on 9th of October, number of active cases, and then there was a drop. So by 30th of October, the disease was well in control in Uttar Pradesh, and replicability and future expansion, protocols, material preparedness for such epidemics in future, techno-managerial learnings can also be replicated for other virological outbreaks like FMD, epidemiological analysis, forecasting, database management we did for the first time, and strengthening of lab facilities. When the disease started, we had only one lab in Bhopal, central lab, which was doing this. Tuvasu and IVRI did this subsequently in UP. We are going for 5 more labs. Efficient control of lumpy skin disease in UP, and that's my last slide. So I would like to invite the attention of honorable jury members on this. If you look at the major affected states, 8 out of 22, these are the major states from Karnataka to Maharashtra, Gujarat, and all the way up to Punjab. And if you look at the mortality rate, it ranges between 5 and 7% on an average, Punjab being the highest. In Uttar Pradesh, it was 655, mortality rate of 0.58%, and which was not only the lowest in country, but we went and made a presentation to Government of India, and I have this copy which I made it to Shri Purushottam Rupalaji, Honorable Minister of Animal Husbandry, Government of India, and he lauded the efforts of UP and the initiatives taken in an all India meeting held during the pandemic. Only 0.6% of cattle affected, recovery rate 99.5%. So, I mean, this was something which, as a team, taking leadership at all levels, we managed to do. And here is a happy cow. Thank you.
I think you have done a commendable job in containing the disease in the state of Uttar Pradesh. So, and this protocol, as you said, this is, I mean, I don't know, maybe the exact modus operandi could be different, but it's something similar to what we felt during coronavirus. You know, the same way the highly spreading communicable disease can be contained. So coronavirus we contain in a very commendable way, the same way you have done for the cattle. So animal and humans, controlling any communicable diseases, you have to have a strategy depending on the type of the virus or type of the disease and the way it spreads. which you identified and put a belt system so that you can go to the maximum affected area in a shorter time. Can you not make a device, like you said, the protocol, but can you generalize the protocol and spread it across so that all animals, all diseases, of course, the targeting will be a little different, but that protocol, that can be a sub-protocol. The overall protocol can be devised and it can be, used elsewhere in other diseases also, or not for LSD, lump skin disease, but it could be for any other communicable disease in the animal, like the veterinary sector.
Can I respond?
Yeah.
You have made a very valid point, ma'am. In fact, I was Principal Secretary Health, Medical Education of Government of UP when this COVID-19 pandemic happened. And during that time, I remember we set up 52 dedicated COVID hospitals, and we set up ICUs and we set up labs within 90 days of time in UP. Apprehensions were similar, but human epidemiology and animal epidemiology and management, though it has its overlaps in terms of physiology, but there are some differences as well. So in COVID, as you see, human movement restriction is not very easy. Whereas in animals, restriction of movement is relatively easy. And this kind of an immune belt which we created around 320 kilometers from Nepal to Madhya Pradesh. Now, this was done sometime in Malaysia, never tried in India. So this was suggested to us and we went into the literature. So this is something which makes it different from COVID virus management. And if you look at epidemiological forecasting, then in COVID virus, it is basically, it spreads through, sneezing and other things. Whereas here it is basically through multiple factors. Primarily it's vector borne, and flies, ticks and mosquitoes, these vectors transmit this disease. So
Hey,
vector
I'm not
control
saying they're
is
saying.
a
No,
major language.
Just a minute. I'm not saying they're saying. What I'm trying to say is the modus operandi, the way you set up the centers, the isolation centers, procurement. I'm talking about the major steps. That could be, that protocol can be devised, and then it can be the sub protocol under each, like how it communicates. One is a vector borne, one is airborne. All those things can be separately done. That's a micromanagement process. So what I'm saying is, the overall protocol, like you must go for procurement, you must go for, targeting, isolation, all those bigger things. That kind of a protocol can be devised. It can be used for, as a general thing.
Correct, ma'am. Actually, this idea of having dedicated isolation centers for animals, that came from the COVID isolation centers.
Right. Exactly.
Which was tried on a large scale in UP, and we did 89 of them. But other interventions are unique to animals.
Okay.
And you are right that this can be replicated not only for other virological disorders, but now it gives us a template where it can be customized for bacteriological and other disorders also. That's right, ma'am.
But very, very nice attempt. And I must congratulate you for containing, at least 1%. And that's really, really great.
Thank you.
Compliments to you, Dr. Dubey. I think it's really a wonderful job done in a very short period of time. Humongous work. I have just 2-3 small questions. One, is it only limited to the cows, or it is there in general other animals also? This particular problem. Lumpy
So you
skin.
have something called goat pox, which happens in goats. And that virus also belongs to the poxviridae family. This is cattle pox, which affects cattle and buffaloes. But buffaloes are hardier. So in buffaloes, the mortality is 0. So I recall one buffalo dying in Haryana or Rajasthan somewhere, but that was the only report I could come across of mortality in buffalo. So in cows, what happens is that cows don't have that level of immunity. So these nodules are visible to the eyes, but where it hits is the pulmonary system. So pulmonary complications and hypoxia is what kills these cows.
My second question is, this disease you said came from Rajasthan, Haryana, and I'm sure by the time it came to UP, it must have been there in other states also. You think that they didn't have all these protocols and it could spread so easily to other states? Couldn't it be contained there with all these measures and protocols?
Sir, frankly speaking, in India, there was relative less appreciation of cattle health risk management. And we have systems, but nobody has really tested them. And if you look at FMD, for example, it again is a viral disease, foot and mouth disease. In India, the total production capacity of FMD vaccine is still sufficient only to meet 25% of requirement. So there needs to be capital investment in production of vaccines in labs, in virological testing, and other related areas so that animal epidemiology is also addressed. This is something I believe the time has come to address because the way climate and environment is changing, all kinds of new viruses are also coming up. And I'll not be surprised if a zoonotic disorder comes up in some animal, which spreads to humans. LSD doesn't spread to humans.
Going forward now, we all know that in most states, some states more, some states less, but there's a huge dependency on the livestock income of the farmers. Going forward, this model can be replicated in other states.
Sir,
Government of India.
This can be replicated. Actually, it's when it started in Gujarat, people thought wo wahin par reh jayega. When it came to Rajasthan, for example, now that you have asked me a question, I believe they also didn't realize that this disease could take such enormous proportions. And then they decentralized the vaccine procurement to their district level offices. And then they went into the same tendering process. So Rajasthan took almost 30 days to procure first batch of vaccine. So, and then when it came to Haryana and Punjab and then UP, so by that time, I believe one issue is also the sensitization at the highest level as to the seriousness of the disease. So in UP, Honorable Chief Minister Shri Yogi Adityanath ji, there is an emotional angle to it as well. So he was very particular about treating cattle and humans on the same pedestal. So we did exactly those things which we did for maybe something we did in COVID virus. We replicated that. We entered into partnership with IVRI and DUVASU. In fact, we engaged their students also in the field from DUVASU and Ayodhya University. And we went into procurement on a very transparent note. I engaged with Indian Immunologicals and Esther, Ahmedabad, which are the two vaccine providers. They supplied the Rajasthan vaccine at 6 rupees per dose, 5.5 for Haryana. I said, you give me at 5. And then we did it 5 rupees plus GST. And then the government of India has adopted our benchmark as the standard price for procurement of goatpox vaccine.
Dr. Dubey, thank you very much for giving a comprehensive presentation. But this corona vaccine was developed over a period of 1 year or so, and went through clinical trials and modifications and all that. Was this lumpy skin disease vaccine ready-made or it was also developed?
Sir, basically, goatpox is the vaccine which was developed in vivo by Hester and Indian Immunologicals. So goatpox virus provides cross immunity against cattle virus. In fact, as on date, there is no commercially tested LSD vaccine in the country. IVRI, after this epidemic happened last year, now there is an understanding and appreciation of cattle disease threat in the country and the consequent impact on economics and livelihoods. So then NDRI Karnal is currently testing it in the field, sir. So once it gets tested in the field, then maybe after some time we have a specific cattle pox vaccine in India.
Thank you, please, for the good clarification. I was thinking that it was readily available. Thank you.
So lucky that your goat pox could help, cross vaccination or whatever. So
Yes, ma'am, that could help. And then the modality of vaccination was very important, because in other states there was, I don't want to say that, but maybe peer review will help out there with Government of India. The vaccination was done as a generic kind of thing. We focused our vaccination as per our epidemiological forecasting one. And then we tried this circular vaccination and macro belt vaccination, and we monitored their progress. We gave them MVUs and it was monitored at the highest level. In fact, every day in the morning, our team at 8 o'clock in the morning would do it for 90 days non-stop.
in fact, one more thing here. This is besides the presentation, but the epidemiological forecast for animals, we do it for communicable disease or even non-communicable disease in India. We do have a lab in Delhi and all that. But do we have any such thing for animals?
मैडम एनिमल्स में क्या होता है कि अभी जो है ये कुछ काम वहां हो रहा है। हमने डुआसू मथुरा में शुरू किया, एंड नीरी आई बिलीव इज डूइंग समथिंग, नीरी एट हैदराबाद. So
but Needy suppose that is
environmental institute.
Environment biology. Okay,
environmental institute, ma'am. So actually what happens is that इसमें होता है क्या, जैसे एक cow में infection हुआ, उसके nodules आ जाते हैं on the skin, and when those nodules burst, then the infection starts also from the nasal secretions. So then when the flies sit on that, from the flies that virus spreads to other areas. So you have to look at wind velocity, in which direction the wind is flying.
But that way environment comes into picture.
Okay. Ma'am. And then you have to look at how fast can a fly actually cover distance. So it is between 2 to 3 kilometers per day, which a fly can manage. So then you know in which direction will this go, if the flies take it. Because we had already enforced an absolute ban on movement of animals. So we took the help of police, we took public and Panchayati Raj people into confidence. All the melas were banned in an absolute sense. So none of this was taking place. So the flies was the one which was taking it. So there, depending upon one, cattle density, and number two, these factors, you can actually predict in which way it is going. But this was for the first time, and I won't say that the prediction came 100% true, but yes, what they said largely came true. And we went for this belt exercise based upon.
At least you had a reference point. We had a reference point, ma'am, and this belt from Pilibhit all the way to Madhya Pradesh, Gwalior, this helped in containing the disease into the western part. This immune belt really helped us in good stead, which was not tried earlier. We were also very uncertain about it, but then it really helped, and you can see it from the epidemiology. Very, very well done. Very well done.
Thank you, Dr. Dept. Thank you.